I am Dr. Sanjay Pandey, consultant urologist at the Kokilaben Dhirubhai Ambani Hospital in Mumbai. The topic that I touch today is a topic of high degree of sensitivity. It is something which is close to my heart because having trained in this subject approximately 18 years ago and taking this on a journey to be able to help individuals who are entrapped within their own body is an important aspect of care. Let's touch this topic of gender dysphoria. Gender is something which is an internal understanding of the body, and sex is something which is visible to us in the body. So gender is the inner feel. You feel something about yourself. Sex is something which is visible by your organs and visible to you. Let's start this topic by understanding that there are individuals who are called as transgenders. Transgenders or individuals who are called as transsexual gender identity disorders in the past are individuals who are actually now labeled under the umbrella of gender dysphoria. Gender dysphoria, which means that dysphoria is something which is opposite to euphoria. Dysphoria is a Greek word which comes from the meaning of hard to bear. I can't bear that I am this, I am somebody else. So the individuals who are transgenders go through a phenomena of understanding themselves that I am not the one who is within my body. I am somebody else. And in doing so, very early in their life and thereafter, they continue to feel that I need to come out of this entrapment. They continue to feel, but they're not able to tell. They can't tell their parents, they can't tell their peers, they can't tell their teachers. They continue to grow from adolescence to adulthood. And they live in this agony. And there could be anybody in the society because it's an internal feeling completely. When I, over the last 17, 18 years, have looked into this subject and looked into individuals who go through this agony of being otherwise as normal as you and I are, but go through the trouble of suffering. The suffering which is not of any disease that is visible to you and me in any test or anything around, but of an internal feeling which is not my body, has got a biological or a scientific connotation. In other words, since the moment of conception, when you become an XX and an XY, and you gradually then grow through your hormones in the womb and thereafter, there's a full-fledged circuit change where there's a lifelong orientation happening around. Somewhere in the younger age group, there has been this feeling that I am not the one whom I'm called for. If I am called Sanjay, I feel I am Sanjana. If somebody is Sanjana, he wants to become a Sanjay. That means the organs that have been given to me, which in my growing years looks to be not my organ, they very commonly are individuals who are transgenders or gender dysphoria individuals who need to be cared and treated for. The subject is under the world's umbrella body called WPATH, or World Professional Organization of Transgender Health. WPATH is the international body which meets once in every 2 years. Being a part of this body for the last 15 years, understand that there are so many aspects of care. That means we is stronger than I. Individually, I may not be able to make a difference. But yes, to bring about a difference to individuals with gender dysphoria is all about doing a multidisciplinary work with a very multimodal phenomena to help them out. So a transgender individual who comes to me at the Kokilaben Dhirubhai Ambani Hospital for the last 15, 17 years has undergone a radical change in life already by being understood by the medical fraternity. The medical fraternity, which starts with a psychiatrist and a clinical psychologist, identifies these individuals and agrees to the dream or to the aspirations, so the internal requirement of the body by going through a set of investigations, so a set of evaluation and psychological tests, which gives them an idea that this is an innate internal feeling, a feeling where I don't want to be called this, not my body, and I want to undergo a change, albeit progressively and gradually under the ambit of law, under the ambit of the science. So clinical psychologists and psychiatrists at the bottom of this are the crux of the subject because they identify the individual, certify them that these patients are gender dysphoria patients and deserve care. They undergo a hormone therapy with endocrinologists, and a hormone therapy is close to a lifelong phenomenon. The hormone therapy, which is what you're looking forward to, like a male wants to become a female and a female wants to become a male, not a very common phenomena according to nature. But for these individuals, a set of individuals in each city, country across the world go through this phenomena of transgenderism or going through the phenomena of bringing about a repair to their organs around. They don't want those organs which is the part of their body. So when I look at male to female, that means individuals who want to become a female or trans women, they want to have female hormones. So endocrine doctor or endocrinologist or a hormone doctor would give them those medications, which actually gives them a little bit more peace in terms of getting the right hormones. As that is happening around, there will be a set of therapies which happen around. This all again is in the ambit of law, in the ambit of the Indian modifications of the Indian system and the laws which help these individuals their right. So their right to live, their right to be able to get what they want is now available in India, which was missing 15, 17 years ago when I started the subject back here. So to me, gender dysphoria comes with a lot of passion in terms of helping people out. When we look at males to females, obviously, we do something called as a vaginoplasty, creating of a labia majora, labia minora, clitoris. These are all made from your own body structures. Bring them out of entrapment by removing the organs that they don't want, giving them the organs both by aesthetic and a functional sequence. That means organs should look like capable, approximately as good as it is in the cisgender individuals, should be functional organs in terms of a vagina or vaginoplasty. On the other side, in a female to male, a female wants to become a male and it has a very strong innate powers that I want to be one, would progressively move in a direction which defies profile. Why? Because apart from a psychiatric care and a clinical psychologist proving it, and the legal laws of the land and the affidavits, they actually go to hormone treatment, but there are various ablations going to happen. On one side, the uterus and the ovaries are removed. Other side, the breasts are removed because these organs are not required by them. What they later on want is either a metoidioplasty, which I continue to do at the Kokilaben Hospital, or a phalloplasty. Phalloplasty is to create a new organ with aesthetic and functional sequence where they could have sensation, they could have an organ that they would play with, get a feeling, get a sensation through which they could be able to perform sexually with their partners. And later on, when the urethra is created in set of individuals, you could actually have a urinary passage which is created new for you. The vagina is closed. So these individuals, as a male to female, are totally different sequence altogether, where there is an ablative surgery which goes by sequence, the reconstructive surgeries go by sequence, hormones continue, and they are handled in the journey towards progression. Not everybody undergoes surgery. Gender dysphoria is about coming out of entrapment. By good clinical and psychological care, many people are stable there. Many people would require only hormone therapy and are stable there. Many people would require a set of surgeries, but not all surgeries. So a lot depends on the individual who is going through the agony of being entrapped in the body with the organs that he doesn't want. The subject is now not closed, it's an open subject and people know about it. They have been living with entrapment, living with suicide, living with difficulty because the previous treatment of psychological care and forcing and rewarding and pushing them to what we believe is normal is probably changed. So I think the subject has got its roots and bearings and progressively has come to a level which does not hinder the other part of the population. It is important for us to give them the right to live, the right to get better and right to probably take it in their journey because they're as good as you and me. So gender dysphoria, treating by gender reassignment or gender reaffirmation surgery, to me as a uroandrologist and a reconstructive surgeon, helps to take those subjects forward in a journey. It's not a one-step journey, but all these individuals are partners who help you out or across the table, counsel them, talk to them, identify and probably help it out. So various techniques that we employ in surgery, a lot depends on the individual's healing powers, a lot depends on individual's aspirations and requirements. At the Kokilaben Hospital, the gender reaffirmation surgery has been a program, has been a kind of a therapy where a lot of colleagues in various aspects of the society have actually come in, got treated, has reached a level which probably is a very satisfying and a gratifying phenomenon. Thank you so much.